question. Right, so if you have read and understood, considering this surgical anatomy station, kindly tell me what exactly are you looking at?
Yes, ma'am. This is the gross and radiological image of the ear.
Yes.
Most probably it's the right ear.
All right. Would you be able to tell me what this red impression labeled as 8 represents or signifies or shows?
It might be a middle meningeal vessel, middle meningeal artery.
Okay. Can you please identify this structure labeled 24, red?
Stapedial artery, ma'am.
18, this blue one.
Yes, ma'am. It's the superior bulb of internal jugular vein.
And 17 over here, this little red.
It's the carotid, internal carotid artery, entering in the carotid.
What is this 21?
It's the styloid process.
All right. If you can tell me, what are these 13 and 9 over here and 26? What are these?
Yes, ma'am. These are ossicles of the ear.
All right.
13 is the medius and 9 is the incus.
Yes. Okay. Here you'll see one yellow 22 labeled as 22. Can you please identify that?
Sorry, ma'am. I would like to come back to this.
Okay. Right. Moving on to the right hand side image. Can you please tell me what this 2 is?
It's the semicircular canal.
All right. We'll come to the answers at the end. What is this 10, please?
It's the same, ma'am. It's the internal jugular vein, superior bulb of internal jugular vein.
25, if you can identify, please.
It's the carotid artery.
5, please.
Internal carotid.
5.
That is a foramen lacerum, ma'am.
7.
It's the lesser petrosal nerve entering from the anterior end of
and
the.
Here is also one yellow, number 4.
Yes, ma'am. It's nerve to stapedius, cauda tympani nerve.
On the upper right hand corner, there is one image. It is labeled 13, 9, and EAM. What does that show? What is 13? What is 9? And what is EAM?
EAM is, ma'am, external auditory meatus.
Very good.
21 is the styloid process, and 9
yes.
and 30. Yes, ma'am. 9 is the handle of malleus, and 13 is the long process of incus.
All right. Can you please tell me the boundaries of the middle ear?
Yes, ma'am. Superiorly, there is a tegment tympani, which separates the middle ear cavity from temporal lobes and middle cranial fossa.
Yes.
Inferiorly, there is a thin plate of bone which separates middle ear from the jugular venous bulb of internal jugular vein. Anteriorly, there is internal carotid artery along with sympathetic plexus in the lower part. And
Yes.
in the superior part, there is eustachian tube or pharyngotympanic canal and canal of tensor tympani. Posteriorly, yes, ma'am. Posteriorly, it is separated from the mastoid air cells, and lateral border is lateral wall is tympanic membrane. In its upper part, there is lateral wall of the attic. In the medial part, it is separated from the lateral wall of inner ear.
Okay, can you please tell me how the middle ear infection crosses the skull?
Yes, ma'am. Middle ear infection can cross directly from its superior wall through the bone, and also posterior.
Yes, erosion of the yes wall, and then
yes, ma'am. And also posteriorly, it can cause to mastoid adductus into the mastoid air cells, and from there it can go to skull.
causing mastoiditis. Okay, if a patient presents with meningitis, what would be the clinical features or clinical picture that you'll look out for? How would patient present?
Yes, ma'am. Patient will present with severe headache, neck stiffness, altered sensorium, photophobia, vomiting, along with sensory neural deficit.
Okay, good.
And also signs of raised ICP.
Yes. So can you please tell me what lies or what are the relations of middle ear, the medial wall?
Yes, ma'am. Medial on the medial wall, there is a promontory in the lower part with oval window and a round window.
Yes.
And in the posterior superior corner, there is a canal for the facial nerve and other impression of lateral semicircular canal.
Yes. What do you mean by the oval window, oval and the round window? What are
yes,
these?
ma'am. These are the defects in the bone of the lateral ear canal, which are covered by the membrane in the round window, and in the oval window there is a stapes footplate fixation, which is mobile.
Yes.
So that is how the sound waves are traversed from the ear tympanic membrane through the ear ossicles to the inner ear, to the endolinx.
If there is transmission or spread of infection from the middle ear to the brain, which lobe of the brain would be affected?
The temporal lobe of the brain would be affected.
Yes. Then this temporal lobe is responsible for what features of infection of temporal lobe patient presents as what? Like what would be the clinical features?
So usually it is associated with the area of the hearing areas, and also the sensory aphasia would be caused if it's in the dominant lobe.
Okay.
Due to affection of Wernicke's area, which is a sensory area for the speech.
All right. Can you tell me about the great auricular nerve? Which area does it supply? From where it originates and what is the course of it?
Yes, ma'am. Great auricular nerve, it arises from the glossopharyngeal nerve, and it supplies the middle ear cavity.
It doesn't.
Okay, sorry.
Yeah, that's okay. I asked you out of. Right, what else? All right, there is one question. Since you examine vestibulocochlear nerve along with another nerve, facial nerve, how would you differentiate between the upper motor neuron lesion and the lower motor neuron lesion of the facial nerve?
Yes, ma'am. In the upper motor neuron lesion of the face, upper part of the face on the contralateral side would be spare, and there would be affection of the facial movements on the lower part of the face.
Yes.
However, in lower motor neuron palsy, there would be whole of the half side of the face would be affected on the
Will be
contralateral side.
affected. Very good. Okay, good. Right. Yes. So good. Thank you. Can
Thank you,
you
ma'am.
tell me the common tumors of the ear or the middle ear?
Sorry, ma'am.
The common tumors of the ear, middle ear?
Uh, Sorry, it's a vestibulocochlear schwannoma, but
And
for the
other-
middle ear, I
and
think it's cholesteatoma or cholesterosis.
are they mostly benign or mostly malignant, which is the most common?
These are mostly benign, ma'am. They are not
Okay.
malignant.
Okay. All right. Thank you.
Thank you, ma'am. Thank you.